Many people focus on brain health only when memory problems appear. But what if some of the most commonly used medications, taken for sleep, allergies, anxiety, or bladder symptoms, are subtly increasing long-term cognitive risk years before any symptoms show up? Today, I want to explain which medications raise concern, why they affect the brain, who is most vulnerable, and what safer strategies you can discuss with your physician. A large group of medications share a common effect. They interfere with acetylcholine, a neurotransmitter essential for memory, attention, learning, and normal nervous system signaling. Acetylcholine plays a central role in memory formation, focus and processing speed, communication between brain cells, parasympathetic, rest and digest nervous system function. When medications repeatedly block this pathway, brain signaling becomes less efficient, especially in regions responsible for cognition. Anticholinergic drugs block acetylcholine at muscarinic receptors. While this can reduce symptoms like nausea, bladder spasms, or motion sickness, the same mechanism affects the brain. These medications appear in multiple categories, including first-generation allergy medications, over-the-counter sleep aids, certain anxiety medications, bladder control drugs, some gastrointestinal antispasmodics, motion sickness treatments. Many are prescription medications, but many are also easily available over the counter, which is why long-term exposure often goes unnoticed. This concern is not theoretical. Large observational studies and meta-analyses involving hundreds of thousands to millions of participants consistently demonstrate that anticholinergic medication exposure is associated with a higher risk of all-cause dementia and Alzheimer's disease. Risk increases with higher cumulative exposure and longer duration. Use for several months, not just years, has been linked to a significant increase in dementia risk. Neuroimaging studies show associations with brain atrophy and altered brain metabolism. Importantly, these findings suggest structural and functional brain changes, not just temporary grogginess or sedation. As we age, natural acetylcholine production declines. This means older adults already operate with a narrower margin of cognitive reserve. When medications further suppress acetylcholine activity, brain signaling becomes less resilient, memory centers such as the hippocampus are more affected, the risk of cumulative injury increases. This helps explain why older adults, especially those over 60, appear to be at higher risk. One of the most important and under-recognized issues is combined anticholinergic burden. A person may be taking one medication for sleep, another for anxiety, another for bladder symptoms. Each drug may seem modest alone, but together they significantly suppress central nervous system signaling. This additive effect is commonly seen in clinical practice and can accelerate cognitive symptoms over time. Context matters. Short-term or occasional use may be appropriate in specific situations, such as acute allergic reactions, short-term insomnia, temporary symptom control. The primary concern is daily, long-term use over months or years, particularly without regular reassessment. Check both prescription and over-the-counter products. Ask your physician or pharmacist whether any contribute to anticholinergic burden. Medication changes should always be supervised by a healthcare professional. Depending on the condition, there may be options with lower central nervous system impact, such as second-generation allergy medications with reduced brain penetration, non-anticholinergic bladder therapies, alternative sleep strategies, or medications with minimal anticholinergic activity. The goal is risk reduction, not abrupt elimination. If you've used these medications long-term, this is not a reason to panic. Instead, focus on modifiable brain health factors, including high-quality, consistent sleep, regular physical activity, blood sugar and insulin regulation, cardiovascular health, blood pressure optimization. These factors play a substantial role in long-term cognitive resilience. Brain health is influenced not only by genetics and aging, but also by everyday choices, including medication exposure. Awareness allows informed decision-making. For more practical, science-based guidance on wellness and functional medicine, follow us and enable notifications for upcoming videos.